Hello everyone, I am Manoranjan Burman and you are watching my YouTube channel Medical Lab Tech. Today I am going to talk about coronavirus, which causes the disease COVID-19. In this video, we are going to talk about coronavirus, its structure, mode of transmission, how it causes pneumonia. After an outbreak, what should be the right response to do, and basic idea to develop a vaccine.
Coronaviruses are a large family of single-stranded RNA viruses that are known to cause illness ranging from common cold to more severe disease such as Middle East Respiratory Syndrome (MERS) and Severe Acute Respiratory Syndrome (Sars). So it is the largest known RNA virus and are further divided into 4 genera: the alpha coronavirus, the beta coronavirus, the gamma coronavirus and the delta coronavirus. Till date, 7 coronaviruses have been identified. Those are HCoV NL63, HCoV 229E, HCoV OC43, HCoV HKU1. These are common human coronavirus usually cause mild to moderate symptoms. Most people around the world will develop at least one of these virus infection over their lifetime, and most of the time persons those are infected with the virus are able to recover of their own. 3 additional coronaviruses originated as animal infections. Over the time, these viruses evolved and were eventually transmitted to humans. These are SARS-CoV. This type of coronavirus causes Severe Acute Respiratory Syndrome, which is known as Sars. The first cases appeared in South China in November 2002 with loss of many lives. The next is MERS-CoV. So it causes Middle East Respiratory Syndrome. It emerged in September 2012 in Saudi Arabia. Humans get MERS-CoV through contact with camels that have contracted the infection. The virus is also transmitted by close contact with a person with the infection. And the last one is SARS-CoV-2. This is the novel coronavirus that causes the disease COVID-19. In December 2019, the Chinese authorities notified the world that a virus spreading through their communities causing a cluster of pneumonia cases with unknown cause. In the following months, it spread to the other countries with cases doubling within days. The virus is the Severe Acute Respiratory Syndrome related coronavirus 2 that causes the disease COVID-19, or everyone simply knows as coronavirus. So which is a contagious viral infection that primarily attacks your throat and lungs. Let's have a closer look inside the virus. The virus genetic material contains the information to make more copies of itself by using host cell machinery. A protein layer provides a hard protective layer for genetic material as the virus travels between the people they infect, and the outer envelope allows the virus to infect cells by merging with the cell's outer membrane. Projecting from the envelopes are the protein spikes. So it can make more copies of itself by entering a living cell. If we talk about the transmission, the viruses can transmit through droplets when an infected person coughs or sneezes. So because of the weight of the virus, it can travel not more than 1 or 2 meters of distance. The virus can transmit by close contact of infected person without any safety precautions. The virus can also transmit through something which have been contaminated with the virus. For example, door handle, TV remote, button of your doorbell, button of elevator, and your mobile phone even can be contaminated with the coronavirus, or anything contaminated with the coronavirus can transmit the disease. So if you touch something which is contaminated with the virus and touch your mouth, nose or eyes without washing your hands, then the virus can get into your body. The incubation period ranges from 0 to 14 days, on an average 5 days. Incubation period means the period between exposure to an infection and the appearance of the first symptom. The virus starts its journey from the nose, throat and to your lungs. Once inside your body, the virus contact with the cells of your throat, nose and lungs. The spike of the coronavirus connect a receptor molecule on your healthy cell membrane to insert its genetic material into your cell. A typical flu virus will travel inside a sac made from your cell membrane to your nucleus that houses its genetic material. But in case of coronavirus, other hand, it does not need to enter the host cell nucleus. It can directly access a part of host cell called ribosomes. So ribosomes use genetic information from the virus to make viral proteins and other viral components. Once all the parts needed to create a new virus just gathered beneath your cell membrane, then the new virus begins to bud off from the cell membrane by damaging the infected cell. Now the new virus or the daughter variants can infect other healthy cells and spread in your body. Now we will see how you can develop pneumonia symptoms. Let's have a closer look into your lungs. Its lungs have a separate sections called lobes. So normally as you breathe, air moves freely through your trachea or the windpipe, then through a large tube called bronchi, then through a small tube called bronchioles, finally into tiny sacs called alveoli. Your airways and alveoli are flexible. When you breathe in, each air sac inflates like a small balloon. When you exhale, the sac deflates. There are some small tiny blood vessels called capillaries surround your alveoli. Oxygen from the air you breathe in passes into your capillaries, and carbon dioxide from your body passes out of the capillaries into the alveoli so that your lungs can get rid of when you exhale. Your airways catch most of the germs in a mucus that lines your trachea, bronchi and bronchioles. In healthy body, hair-like structures, cilia lining the tubes continuously push the mucus and germs out of your airways, where you might expel them by coughing or sneezing. Normally, cells of your immune system attack viruses and germs that make it pass through mucus and cilia and enter your alveoli. However, if your immune system is weakened, like in case of coronavirus infection, the virus can overwhelm your immune cells and your bronchioles and alveoli become inflamed as your immune system attacks the multiplying viruses. As a result of the inflammation, your alveoli will be filled with fluid, making a difference to your body to get the oxygen it needs. In this case, you could develop lobar pneumonia, where one lobe of your lung is affected, or you could develop bronchopneumonia that affects many parts of your lungs. The resulting pneumonia may cause difficulty in breathing, chest pain, cough, fever and chills, headache, muscle pain, fatigue and confusion. And it can also lead to more serious complications like respiratory failure occurs when your breathing becomes so difficult. In this case, you will need a machine called ventilator to help you breathe. So this machine saves many lives. Whether you develop these symptoms depend on a lot of factors, such as your age or whether you already have some existing conditions. The coronavirus is often compared with flu, but actually it is more dangerous. The coronavirus is much more contagious and spread faster than a flu. So there are two futures for a pandemic like corona: fast spread and slow spread. Which future we will see depends on how we will react to it in the early days of the outbreak. A fast pandemic is horrible and cost many lives, and a slow pandemic will not be remembered by the history books. The worst case scenario for a first pandemic begins with a very rapid rate of infection without countermeasures to slow it down. So why it is so bad? In fast pandemic, people will get the disease at the same time. If the numbers gets too large, the healthcare system will become unable to handle it. So people will die untreated as many more healthcare workers get sick themselves and the capacity of the healthcare system falls even more. If it will be the case, then horrible decisions has to take. Who get to live or who does not. The death rate will increase in this case. To avoid this, all of us need to do what it can turn into a slow pandemic. A pandemic can be slowed down by the right responses like social distancing, hand washing, especially in the early phases, so that the less people get sick and everyone who gets sick can be treated. Since we do not have a vaccines for corona, so we have to follow mainly two things. One, not getting infected, and the second, not infecting others. The very best thing you can do is wash your hands with soap and water. Soap is actually a powerful tool. Coronavirus basically consists of a large layer of fat, and the soap breaks the fat layer and leaves it unable to infect you. So wash your hands frequently. The next thing is social distancing, which is not nice experience but very important to do. This means no hugging, no handshake. If you can stay home, then stay at home. You have to protect those who are working to save many lives, like the doctors, nurses, other healthcare workers like laboratory technicians, police, cleaners, etc. On a larger level, there are quarantine, where there is travel restrictions and you are ordered to stay home without contact with anybody. Since the vaccines have not developed, the quarantine is the only way to protect the community. So if you are put for quarantine, you should give respect of it. The basic idea is to develop a vaccine is that you would get a sort of a faint version of a virus. The vaccine would expose your body to a version of virus which is too weak to cause infection but strong enough to stimulate an immune response. So within a few weeks, the cells of your immune system would make antibodies. So within a few weeks, the cells of your immune system would make antibodies, which would be specific for coronavirus, specifically for its spike proteins. Antibodies then attach to the virus and preventing from attaching the receptors on the cell membrane. Your immune system will then destroy the virus, and some of your immune cells will remain as memory cells. So later, if the immune system catches a real virus, then your body would recognize it and destroy it. But it is a race against time to develop a vaccine in the middle of pandemic. Each step to develop a vaccine usually takes many months, if not years. The hope here is to develop a vaccine is very soon. So stay at home if you can and protect the most vulnerable, and don't forget to wash your hands with soap and water at least 20 seconds and as often as possible, or you can use alcohol based hand rub. Thank you for watching my video. Please like, share and comment, and don't forget to subscribe to my channel. Thank you.